my name is Christine Eldredge-Brown. I am a family nurse practitioner student. I see here that you are Zoe Eldredge.
Yes.
What name would you like me to call you?
Zoe's fine.
Zoe. Well, thank you for letting me examine you today.
Mm-hmm.
And what I'm planning to examine is your head, your neck, and your temporomandibular joint. Are you okay with this?
Yeah, that's great.
Okay, and if at any point during the examination you feel uncomfortable, will you please just tell me so? I'm happy to stop if you would like me to.
Yeah, for sure.
Okay. So first of all, I'm going to begin by just examining your head, looking, and your face is symmetrical and your head is symmetrical from this side, and I'm going to palpate and feel for any depressions, bumps, lumps. You have a little depression back here, which a lot of people do. That's all quite normal. Is any of these areas tender?
No.
Okay, your skull size is typical. I don't see any scaly areas, any lesions on your scalp, and I'm not seeing any flakiness, anything like that. Okay, and then looking at your face, will you just smile for me and blink your eyes a couple of times? I'm not seeing any unusual facial movements. That all looks pretty typical. Your face is symmetrical and the contours of your face all look pretty typical and average. Okay. Is it okay if I feel your face?
Yeah, go for it.
And at this point, I don't feel any bumps, masses, lumps. Is there any area that's tender?
No.
Okay. At this point, I'd like to check out your temporomandibular joint. Do you know where that is?
Yeah, that is what's called your TMJ.
Your TMJ, yeah. So it's just right in this area here. And first of all, I'm just going to look for any redness or swelling, which I don't see any. And if you're okay, can you open and close your mouth a few times? Can you open it larger than that? Okay.
Going really far.
I'm not noticing any clicks, grinding, anything of that nature. Are you noticing any?
No, I just avoid openings for wide so I don't dislocate my own jaw.
Okay, well, your jaw seems to open smoothly.
Mm-hmm.
There doesn't seem to be any restrictions there. It seems like you can move that a normal range. And was there any tenderness when you open your mouth?
No.
Okay, terrific. And now I'd like to examine your neck, if that's okay.
Mm-hmm.
So I'm just inspecting, first of all, the symmetry and how straight your neck looks.
Mm-hmm.
And I'm looking for any lesions, any masses. Kind of looks like maybe your thyroid might be a little bit swollen.
Yes,
I'm going to look from the back and the side as well. I don't see any lesions, any masses, anything like that back this way, or from either side. Okay. And I'm looking at your trachea. It looks like it's just straight down the midline, which is where we want it to be.
Mm-hmm.
I'm not noticing any masses off the side of that, just maybe a little fullness around the thyroid area. Are you okay if I palpate your neck now?
Yes.
Okay. So I'm just feeling for any enlarged lymph nodes, any masses, nodules. I'm not feeling anything along that chain of lymph nodes. Okay, I don't feel anything concerning there. Will you go ahead and swallow? Okay, I can feel your thyroid move there. And I'm feeling your thyroid, and it does feel a little bit full right now.
Mm-hmm.
but I'm not feeling any nodules. It feels soft. Is it tender at all?
Yeah, it is a little tender.
It's a little bit tender. Okay, so I'm sorry about that. Okay. Any questions or concerns about any of the things we covered today?
No, these are all things I knew.
Okay. Well, thank you for letting me examine you. I appreciate it. And you have a terrific day. Nice to meet you, Zoe.
All right, thank you.